And thanks for staying with us. Now we're looking at health issues. With a population of about 6 million people, Borno State has less than 200 doctors. This has prompted a health sector delegation from the state to embark on a mission to the Ministry of Health and a National Health Insurance to seek a collaboration and partnership scheme. The group believes that this will help to strengthen the health system in the state and provide better access to care for the vulnerable population, which have been affected by the insurgency. And Kemi Balugu reports.
A significant proportion of vulnerable people in Borno State do not have access to proper health care, making them depend on other means of support from humanitarian agencies and government of host communities. This is due to the ongoing insurgency in the state, which has had a severe impact on the health system. This advocacy visit to the Minister of Health and NHIS office by a health sector delegation is led by the Chief of Staff to the Governor of Borno State. It seeks support to help in improving the state's health system and access and affordability of care for citizens of the state.
Before the insurgency, various governments of Borno State had invested a lot in the health sector by building hospitals, primary health care centers virtually in all the wards. But as a result of this insurgency, most of these things have been destroyed. The total cost for destruction in Northeast is about 9 billion. And Borno took the lion's share of 6 billion. Almost 2/3 of the destruction is in Borno State. So this shows that, really we need assistance, not only from development partners, but also from the federal government.
In Borno State, one doctor has to cater to about 30,000 people, and this is grossly inadequate. The Minister of Health says that the government is ready to work with the state to ensure that all Nigerians have access to affordable health care without causing any hardship to them.
Put our hands together and also our heads together to see how to alleviate the sufferings, how to meet the challenges there. Borno in itself is challenging enough due to its size, and if you add to it the insecurity going on at the moment, it makes it even more difficult to achieve the objectives and targets that the rest of the country is geared to achieve.
In the state, Borno State, we have less than 200 doctors. Population of 6 million. So one doctor per 30,000 people. And recently, His Excellency recruited about 18. We are going to advertise to recruit 40 more. We have less than 1,000 nurses. And recently, we recruited over 360 nurses. Pharmacists, we have only 7. And we are going to recruit 45.
A new primary healthcare model that will effectively give services to the people and provide the needed health care will be developed, but this can only be done after the insurgency ends. The National Health Insurance Scheme is also ready to key into this to help the state.
These primary healthcare centers have to be located in secure areas and as much as possible in the middle of where the community is, so that everybody can reach it. It should be in the middle of the community so that people from everywhere can reach it, even by foot, even by night, and be able to get the most basic of services. And that allows a huge improvement in services and availability.
We National Health Insurance, they also have an organization akin to that, which is a state contributory agency that is supposed to drive the activities of social health insurance in that state. So we normally have a platform for collaboration under our new innovative platform that is called Health Insurance Under Our Roof, where we come together and discuss issues that has to further the implementation of social health insurance in Nigeria.
We have discussed some issues which are very cogent and very important to the attainment of the universal health coverage, especially in terms of our peculiarities in Borno State, where we have a lot of vulnerable populations due to this protracted insurgency that we are having for over a decade now. So as a result, a lot of people were displaced from their means of livelihood and other related issues like that. And then we find out that health delivery is one of the key areas whereby those people can actually be assisted.
More than 1.3 million Nigerians have been pushed into poverty due to out-of-pocket expenses, and about 90% of the population of Borno State citizens access healthcare through out-of-pocket finances. Kemi Balogun, TVC News, Abuja.